Boa tarde a todos, sou Thalita Ferreira, CEO da Legis Consultoria e hoje estamos aqui para falar de um tema exclusivo e único que é sobre o MoCRA, que é a legislação que está estabelecida para os Estados Unidos para a modernização dos cosméticos no mercado norte-americano. Hoje temos um exclusivo também, consultor, que vai falar um pouco mais para a gente sobre esse tema e falar como que a gente está conduzindo isso nos Estados Unidos. Tenho aqui hoje o John Misock. Ele é consultor sênior regulatório, ele tem uma expertise muito ampla no mercado norte-americano, ele também já trabalhou no FDA, e o John vem aqui compartilhar mais conhecimento estratégico com esse mercado que só vem a crescer no Brasil. John, I would like to invite you to enjoy to us, to talk and share your knowledge. Antes do John começar, eu gostaria aqui de explicar um pouco que esse webinar ele vai ser conduzido no inglês pelo John, mas também vai ter o meu suporte aqui e meu trabalho, né, para toda a tradução. Então, não fiquem receosos de mandar qualquer pergunta. Essas perguntas serão traduzidas por inglês para que o John compartilhe o seu conhecimento sobre o mercado norte-americano. Hello, John. How are you doing?
Olá. Bien, gracias.
It's great. So, John, you can start your presentation. So, thank you very much for being here with us today and share your knowledge with the companies in Brazil. It is so important this information that you present today because we have a great marketing Brazilian market with cosmetic, and the companies in Brazil would like so much understand how they can introduce the product in the Brazilian market, but also keep this product in other countries as United States. So thank you very much. And if you can just before put your presentation here to explain a little about what we'll talk today.
Okay, thank you. Let's see, share screen. Okay.
Só um minuto que o John já vai compartilhar a apresentação dele.
Let's see, I want to present, share. Share screen. Okay. What's going on? There we go. Did I share?
Yes, you can. You can share.
Okay, that's it.
Perfect. Thank you, John.
All right. I'll get it. All right. Thank you for the nice introduction. As Thalita said, I've got a lot of experience in cosmetics with FDA, and I also spent 10 years with Estee Lauder, which is a large multinational company. So I've been around for a while. So today we're going to talk about MoCRA, the Modernization of Cosmetic Regulation Act of 2022, which recently went into effect in the U.S. If I can
You can go ahead if you want.
Yeah, I'm trying to. I don't know why it's not moving. It should be moving. I don't know why. I'm not getting any response from my mouse. Why not? I don't know. I can't get it to move. Okay, you're in the show.
Would you like to share again? Put again? Or I can see your mouse, so if you can go ahead.
Say stop sharing, present, share screen, window, entire screen, share. Is it up yet? No? Yeah, there we go.
Yeah, we can see again.
Now what? Oh, there we go. Yesterday this worked fine. Stop screen, present. I don't know why I can't get it to work. I can't get it to move.
If you wanted to put the presentation in slide presentation, so put and select the presentation to go ahead.
I know. Yes, but my mouse is not working. Why? Nothing working. What is going on? I don't know why. I don't understand. Oh, here we go.
Yeah, now we can.
I'm on the wrong screen. Okay, here we go. Here's an overview of what I want to cover today. The MoCRA is the first major change to cosmetic regulations in the United States since 1938. That was when the original Food, Drug, and Cosmetic Act was passed. All right. And under the law, FDA has been given broad new authority to allow them to enforce cosmetic regulations, okay? And also, FDA is mandated to promulgate multiple new regulations, which I'll talk about. Okay, one thing I want to talk about is what are the regulated entities? There are some new definitions. Cosmetic versus cosmetic product, what does that mean? The new authorities that FDA has, the registration, suspension, listing, removal. In other words, if you list a product, they can remove it, and they can also order a mandatory recall. The primary part of my presentation will be these, what I call the 7 elements of MoCRA. Because the whole requirement, if you're paying attention, you might want to take some notes. There's 7 major elements. All right, there's safety substantiation, which if you are in the European market, or maybe even Brazil, I'm not sure, substantiation of safety is required in Europe, but now it's also required in the United States. CGMP is required. Good manufacturing practices people always follow them, but now they're required. Labeling, there's new labeling standards that were also published. And record keeping is a major thing. In the past, FDA never expected cosmetic companies to have written records, but now everything has to be in writing, okay? And then registration and listing, all manufacturers or all facilities that handle cosmetics now have to be registered and and the products have to be listed. As adverse events is another area. There have always been interest by FDA in adverse events, but now all the process of responding and reporting adverse events is in the law, and records must be kept. And then I mentioned the mandatory recall is a new requirement. Okay, so who is this responsible person that's now in the law? This is a new definition. Okay, In the United States, there are a lot of smaller companies that get into cosmetics because it's always been seen as a very easy industry to get into. Okay, so a lot of small, I think there's, I saw the other day, there's 6,500 firms registered so far. So there's a lot of companies, all right? There's small companies, there's huge companies, but, you know, like Estee Lauder and L'Oreal and all the big companies, but the responsible person is the person that the definition is the manufacturer, packer, or distributor of a cosmetic whose name is on the label. Okay, so even if you have product manufactured by a contract company, if your name's on the label, you're responsible for MoCRA. Okay, so brand owners, it's a new thing for the brand owners. In the past, everything kind of fell on the shoulders of the manufacturers, and the brand owner was kind of on the sideline. Now the brand owner is front and center. All right, like I said, they're responsible for everything. To me, it's one of the most important changes to the law, because by the time we get through this entire presentation, I think you're going to be surprised about how many records, written records, are required to be kept. Okay, so, all right. Okay, definition of a facility. This is any establishment that manufactures or processes cosmetics distributed in the United States, all right, including contract laboratories. So it's basically any firm or any facility where they actually handle the product or control the safety of the product, okay? So you think about maybe a sterilized product, the company that does the sterilization, they're considered a facility. Okay, it specifically excludes, it does not include establishments that solely perform labeling, relabeling, packaging, repackaging, holding, and or distributing cosmetics. So if you're just a distributor, if you're just putting labels, you get a finished product and you put a label on it, you're not a facility. Also, retailers, distributors, salons, trade shows also are specifically exempted. Okay, who is responsible? The manufacturer, packer, or distributor? Well, it's all of them. It's basically the name that appears on the label. Okay, that's the person. And it doesn't have to be a person's name, but if the name of your company or the name of your product or whatever is, that's who's responsible. So if it says manufactured by, and whoever that is, they're the responsible person and the facility. Okay, if it's manufactured for or on behalf of, then that person on the label is a responsible person. If it says packed by, it could be either or. But basically, if your name's on the label in the back, then it's your responsibility. Okay, if it says distributed by, then that person is the responsible party, the responsible person. All right, is understanding who's responsible for what, and we'll get into this more, is a very important aspect of this law. Because, as I said before, cosmetics were, there's very little regulation in the United States cosmetics, and this is totally new. So when it comes down to the enforcement, how FDA is going to enforce it, we're not really sure, to be honest, but we do know one thing: as a brand owner or a manufacturer or a supplier, there's a lot necessary to keep control of, and you have to know who is doing what. Okay. And so we've been recommending that quality agreements be put in place to make sure all these requirements are being handled. And when you need the records, they're available to the responsible person. Okay, it doesn't sound like much, but there's always been a definition of what cosmetic is, right? But now they added the definition of cosmetic product. And the reason they did that is to clarify that even if it's, say, a mixture of a bulk product that's being shipped to somebody to be repackaged, that is also covered under this law. Okay, so cosmetic products is technically a preparation of cosmetic ingredients with a qualitatively and quantitatively set composition for use in a finished product. So this means that if you're a packaging company and somebody's making the bulk, they're also a facility. Okay, so there could be multiple facilities that have to be registered in order to successfully avoid any prosecution from FDA. So it includes single and multiple ingredients. So some questions we got were, well, how about somebody that if we're just packaging oil, some safflower oil or whatever, is that a cosmetic? Yes, it is. So it doesn't. If it's intended to be used as a cosmetic, it's a cosmetic product. Okay. Ingredient suppliers themselves, like the ones that sell you bulk glycerin or bulk, anything, they're not considered cosmetic products. They're ingredients, but they're not covered directly under MoCRA. I put this here: soap is still soap, and then there isn't. And soap has always been soap is like bar soap has always been it's always been excluded from the cosmetic definition, but only if it's pure soap. Okay, so really, I think what MoCRA is doing, if you're in the soap business, you're more likely to be included as a cosmetic than not, because if you add anything to the soap, like fragrance or moisturizer or any kind of cosmetic claim, then you're cosmetic. Okay, just to clarify that. All right, here's just graphically what the 7 elements, right? We got safety substantiation, top center, the most important part. Then you got that leads to GMPs, labeling. After that, record keeping, registration and listing, adverse event reporting, and mandatory recall. So you can see how they all, you end up in a kind of a circular situation where, when your product goes through all these steps and everything's right, and you go on the market and something goes wrong and you have a recall, and you have to go back to step 1 and redo your safety substantiation, right? Great. Like I said, this safety substantiation is the foundation of MoCRA. And if you're in if you do drugs processing, or if you're also in that business, you're familiar with this. But to the industry, it's always the responsibility has always been left mainly with the suppliers of the raw materials. Yes, our material is safe for use, but now it's that responsible person, the brand owner's responsibility to make sure they have the documentation. All right. Of course, you do it for protection of consumers. A lot of people ask, well, it's an FDA requirement, but why do we do it? Well, I think you really need to do it to protect your consumers. Okay, that's the primary reason. And if you're, like I said, if you're in the EU market, the whole process would compare to the product information package, or PIP, right? But the only difference is in the EU, you're required to submit that data to the government. Under MoCRA, you're not required to submit it. However, you are required to have it in your possession when they ask for it. Okay. So it has to be done correctly on your files. And when the need arises, you have to have it. And I don't know, I'm not going to talk much about ICHQ9, but ICHQ9 is a risk assessment model, which is really the basis for doing, like if you have a new raw material or something that you want to evaluate, this would be the model you'd follow. It's the same one they use for drugs. It's not required in the law, but it's highly recommended. Okay, what is safety substantiation? It's first you identify the hazards, ingredients hazards, packaging hazards, processing hazards. Your service providers, they introduce hazards into your product. And then finally, hazards in the finished product, which is usually, is your product allergen, or does it cause sensitivity issues, those kind of things, or the bacteria count for the final product. That all these things, all the way from the ingredients to your suppliers, everything has to be considered. Now, after you've identified the hazard, then you have to have a level of control that's required, that usually has some kind of testing involved, or how often you do it, and or supplier qualification for instance. So you got the hazard, the level of control. Then you have to characterize the risk. Is it a microchemical or particulate? Oops. All right. And finally, the most important thing, once you've done the safety substantiation, you're going to come up with a set of acceptance criteria. In other words, these are the standards that you require for your product to be safe to be released to the public. Okay. So usually that data, it has to be signed off on by experts. It can be in your own company. It can be a consultant like me, or it can be other people, but it's got to be somebody that's qualified to say, yes, this product is safe. And usually the source of information in the United States most of it would be either from the FDA or what's called a CIR, the Cosmetic Ingredient Review. And that's every common ingredient in cosmetic is listed in CIR. And they do a full safety substantiation. So that's like a starting point. And then what you end up with, the acceptance criteria, is based on what the CIR would say, for instance. Okay, when is safety substantiated? When the facts that support it change, it must be updated. Okay, so it's really a continuous process. As I said, from the graphic I gave, it's kind of circular. So, you sometimes have to go back. You change ingredients, you change suppliers. When anything changes, you have to go back and update your safety substantiation. All right. And like I said, the data for safety substantiation is widely available. There's no shortage of data, right? And we all know kind of, well, we've always done it that way, and yeah, we know it's been approved here, blah blah blah. But now you have to document it. You have to put it in a report that says this is our criteria. Okay, how we came to this conclusion that if we meet these criteria, it's safe. All right, the whole system, if you're involved in drugs, I would compare to a quality management system. Of course, for cosmetics, there's no rule in the U.S. at least, there's no rule to prove efficacy. You only have to prove the safety. Or this is kind of a simplified picture. Bottom left, hazard identification, risk assessment, risk control, risk review, and it's a circular process. In drugs, they call it a life cycle. Okay, good manufacturing practice. I'm sure we're all familiar with this. At the end of this year, FDA is supposed to have a draft available for review that would become law at the end of 2025. And it's supposed to be similar to ISO 22716, which I think is the standard you follow in Brazil. So GMP should not be an issue if you're following the Brazilian standard. They have to support the acceptance criteria. Of course, when you say, okay, if you think the GMPs for mascara, for instance, are going to be different than for lipstick, right? So they have to be specific to the product. All right, still waiting for that draft. It must be written. It must be documented. SOPs must be process specific. Okay, like I said, the process for making lipstick is different than making mascara, so the SOPs have to address that. Basically, in English, you say what you do and do what you say. It must be written. Okay, labeling. Not a lot of labels, labeling changes, but there are a few key ones. Pre-approval of labels in the U.S. is not required. Okay, so that's a plus. But if your label is on the market, it's on the internet, it's on Amazon, wherever, and it's not, there's something wrong with it. FDA has systems, artificial intelligence models that go out and scour the internet and look for problems. Okay, so if you have problems, FDA will probably find them. MoCRA now requires a means for clients to report adverse events to the responsible person. Again, if you go to the European model, that's required over there too. And here, it's not as specific. It just says that responsible person must have a way for people to contact them, either like a website or a phone number in the case of adverse events, okay? And also, professional use labeling is now required. That's funny because this part of the law was added, require the professional labeling because they're having trouble with products that were shipped from Brazil. The Brazilian I can't remember the hair treatments. I can't remember the name of it now, but the salons were getting it and selling it to people, right? But it was never intended to be. So now it has to say for professional use only, right? The basic structure of labels have not changed. That's all the same. You're still required to meet the Fair Packaging Labeling Act called FPLA, all right? And, it's a good idea to always review your labels on a regular basis to make sure that something hasn't changed that needs attention. Okay, non-compliant labels are, like I said, they're invitation for FDA to send you a letter, and it's not going to be a good letter. Okay, so I think we talked about this. So FDA is all over the internet. They don't have resources to have people go buy things and whatever, although they will go online and buy products. Okay. Usually if in the problem is they buy your product, then they test it, and that's when all this record keeping comes into play. Okay. Okay, records. We talked about records. Records have to be maintained. Previous FDA guidance has not required any record maintenance. It's all, you never had to prove that you did anything. Now you have to. Okay. Record keeping is the responsibility of the responsible person. Now, when I said that, you think about all the records that have to be kept by the manufacturer, which is the facility, but the responsible person has to make sure their contract manufacturer is doing the right thing because it's their responsibility. You can contract out all these things, you can compete record keeping and everything, but you cannot pass off the responsibility. I hope everybody understands that. I'm going to repeat it one more time. You can contract out about any service, but you cannot contract out the responsibility. So you have to have good records, and when the FDA asks for them, you want to give them to them. Obviously a record keeping system has got to be well maintained. It should have a system in place. If you follow your process correctly, failure to provide records can result in suspension, right? Even if you're doing a good job and you don't have the record, you can be suspended. And your records must match what you're doing. And your records must be accurate and systematically maintained. In most industries, that's a quality management system and record keeping under ISO 9000. That's what we're talking about, that level. Okay, registration listing is pretty straightforward. Hold on. It's pretty straightforward, but before this law, there was no requirement to register a facility or list products, but now it's mandatory. Okay, so if you've got products in the U.S. market now, I would say it's a good idea to get them registered and listed. And the process is pretty straightforward, but it does get kind of complex, especially if you have several suppliers involved and dozens and dozens of products. Okay. And basically, facilities are registered, products are listed, and they're two separate processes. Okay. And it must be updated when changes occur. There's like a 60-day window, I think, if the information in the registration or the listing changes. Right. The good news is there's no fees. So unlike in the U.S. drug fees, even if you have an OTC drug product, there's $10,000 or $20,000 fee. In the U.S. for cosmetics, no fees. And we highly suggest to seek a professional help, at least for the first go around. All right. And, once you figure out how to do it yourself, and then, that's another thing, but get somebody to help. Okay. Anybody that manufactures cosmetics products must be registered. That, like I said, with compounded products in bulk or compounded products in bulk or filled included. So, like I said, you can have several different facilities that are involved in your product. All right, no retailers. Okay. The cosmetic, mixtures, and this is interesting because cosmetic product includes mixtures and phases that were previously considered ingredients. All right, like this, I think they added this in because there's a lot of botanical and products that are fermented and things like that. And so they're making it clear that even if you're mixing things, it's not just you're required to be registered if it's made to go directly into a cosmetic. Okay, the listing, the registration number of the manufacturer is required on the listing. So you obviously have to know who that is. And you have to have the name of the responsible person, name of the product, the list of ingredients is included in the listing. It's not public, but the ingredients have to be put on the FDA website. All right. And a single listing may be made for identical formulations. Say like if you have a line of cosmetic beauty products that are, only different by color, fragrance, or flavor, they can all be one listing. Product listing numbers are not made public. So like I said, none of this is public. So you got to remember that, but you're still responsible to do it. Okay, adverse events. This is a big area of concern in the United States. There have been some really big recalls in the United States. One of them was Brazilian blowout, the product. I'm not sure it came from Brazil, but it was called Brazilian blowout. But in the old law, there was never a requirement to keep records. Now all the records must be kept. All right. So you have to have a system in place. You've got the contact information on your label. Your customers report problems to you. You have to keep it in record. And then you also have to determine, you have to keep them for 6 years or 3 years if you're a qualifying small firm. They are considered the same as drugs as far as adverse event monitoring. Okay. Only health-related issues required to be documented, and serious adverse events must be reported to FDA. So basically, you have to put a system in place for collecting the data. And this is one of those things that, of course, larger companies either contract it out or they have a whole department that's all they do. Because I know from my time at FDA and working in the industry, people complain about products all the time. So it's very important to know what is an adverse event and what is serious. Okay, so that's a whole area of responsibility that's totally new to the industry. And serious adverse events, the definition was changed. There has always been a definition of adverse events for all FDA regulated products, but under MoCRA, they added this term significant disfigurement, right? And it really is very broad open. It can cover everything from hair loss, persistent rashes, second and third degree burns, or alteration of appearance. Well, alteration of appearance, isn't that what cosmetics are for? So I guess it's alteration. What they mean is alteration of appearance, say like a scar or something that doesn't go away, right? If medical intervention is required, then it's automatic an adverse event. You must report any new information for a year following the event. In the U.S., we have a system that's called MedWatch. It's under FDA, and anybody can report a problem with any FDA-regulated product on this website. Actually, it doesn't have to be FDA-regulated, but this website, anybody that's got a problem can call there. And I know some of the big recalls that have occurred in the United States, a lot of it had to do with shampoo and with hair falling out and that type of thing. So all this kind of falls into this definition of significant disfigurement, right? So by hair loss. Before that, hair loss wasn't considered a serious adverse event, but now it is. All right. Okay. The failure to maintain an adverse event monitoring and reporting system will likely result in delisting or deregistration or both. So you have to have it in place. All right. I think most likely it's not going to become an enforcement problem unless you have adverse events. Then, it's probably going to be automatic. I don't know if FDA is going to, they may during a routine inspection ask you for your adverse event reporting program and any records you have. So you have to have it. And I just put this in here. I'm not sure everybody can understand this, but it kind of goes, how does adverse events get to FDA? Okay, a consumer, doctor, retailer, or anyone can report it voluntarily. And mainly it would be through MedWatch on the left. And the other one is through the responsible person is required to receive it, okay, and respond. It's a regulatory requirement, goes to FDA, and then all the information goes to what is called FDA's AERS, which is their adverse event reporting system, okay. So obviously if people are reporting voluntarily to MedWatch and you're not reporting and you're not getting reports of it and not reporting it, then that's like an imbalance of information. So I can assure you that FDA is going to find out that you're not doing what you're supposed to do. Okay, mandatory recall authority. This FDA has always had a policy of asking people to voluntarily recall products when there's a problem with high bacteria counts or something like that. But now they can just tell you to do it. If you say, no, I'm not going to do it, they have been given authority to, to demand that you take the product off the market. So it's not really a definition, but it's in the regulation. If FDA has a reasonable probability that the use or exposure to an adulterated or misbranded cosmetic will cause a serious health consequence, FDA will provide the responsible person the opportunity to cease distribution and recall the product. And they give you 5 days, okay, to do that. So, it's pretty serious. I'm not aware of any recalls that have happened yet, but I assume that sometime over the next few years we'll see it. And then if you refuse to do it, then they just say, no, you have to recall it. They no longer, in the old days, before taking action, FDA would have to prove that the product was adulterated and misbranded. Now, FDA no longer has to prove the product is adulterated. If they have a reasonable probability that there's a problem, they can order recall. Failure to comply with all these MoCRA requirements is a reasonable probability. Okay. Now here, I don't know if I did this right, but maybe we can talk about this afterwards. But in English, you say a rose is a rose. Basically, this whole thing with safety substantiation, GMP labeling, it's all what we call a quality management system. All right. Now, even though the law does not call it a quality management system, it is a quality management system that the responsible person is required to maintain. Okay, like I said, in order to keep all these requirements in line, it's not in law, but it's really important to have quality agreements with who's doing what. What are your suppliers doing? What are you doing? what are the acceptance criteria? All this stuff have to be put into selecting your suppliers. Like safety substantiation of formula, who's doing that? GMPs, SOPs, you have to have copies. In process release testing, how is that happening? Registration and listing, labeling, adverse events, recalls, all these things have to be agreed to with your suppliers, right? In other words, I can understand, your manufacturer for probably doing a lot of this, but it has to be in writing for the brand owner and both parties, all parties. It's very important to have it in writing. Not required, but highly recommended. Okay, I put this in internet marketing. It's not specifically covered in MoCRA, but I get a lot of questions, especially from foreign manufacturers and distributors. If you're on internet marketing, even if you don't ship it into the United States, you still have to meet the same requirements. Okay, if your product is on Amazon or it's whatever, it's going to run the risk of being discovered, and basically they can then tell Amazon to remove you from Amazon will remove you if you don't comply with the U.S. standard, right? So your source of the products, everybody that's involved in has something is at stake. So I know I just put these comments in here that for internet especially, the FDA pays a lot of attention to marketing to ethnic communities. So like if you're have a product that you're promoting to a specific ethnic community, they're going to more likely to look at it because they're looking for ingredients like skin lightening ingredients are a big problem for some parts of the world. If you just make a skin lightening cream, for instance, that's like automatic. You're going to get found out. So make sure they comply before offering for sale. Now, I put in this my last one. I think the FDA hammer, right? The big story is FDA has much more authority. Okay. And so you got to be ready for that, for the hammer to drop. Okay. Small business exemptions, I have questions about that too. Small businesses are exempt from registration and listing. They require what we call GMP light. In other words, when FDA does come out with the GMP, they're supposed to have a less rigorous version of GMPs that will be required for exempt businesses, for small businesses. And like I said, 3-year records versus 6 years. However, if you manufacture eye area products, injected products under U.S. law would be tattoo ink, baby products. All these products are not exempt under small business. Okay, they have to meet the same standards as a large business. Safety substantiation, labeling, adverse reporting is required for everybody. Okay, even if you're not registered and listed, FDA will know you're in business by scanning the internet and social media. So be ready. All right, I'm finished on presentation, so I'm ready to take some questions.
Thank you very much, John. It was very great to have here. So the points that you emphasize, it was very important for the market and to understand how the companies can commercialize the product in the United States. We have some questions that you'd like just to share with you for you can answer us. So the first one, it is which efficacy studies FDA required for cosmetic in United States?
Okay, what are the
Yes.
efficacy studies?
Studies,
Yeah,
yes.
under MoCRA, there's no requirement for efficacy.
Okay.
For cosmetics, that's the difference between a cosmetic and a drug. Now, when you get into the marketing, and again, say you're comparing your product to another company and you make a claim, then
Okay.
the Federal Trade Commission can make you, okay, show us the data. Like if you say our product is better than our competitor because it does this, right? Well, they can ask you to prove it.
Okay, that's great. And about aromatic candles, what is the requirement for aromatic candles for United States? It's
Aromatic,
classified,
yeah,
yes, it's
aromatic.
classified as cosmetics.
Yes, I did look at this. Aromatic candles are not directly regulated by FDA. It really, if you're using aromatic candles in some kind of professional setting for some, and then it's more of the profession in the state that regulates how you do that.
Okay.
Normally, I haven't heard a lot of feedback, but I know in California, they the cities and counties, municipalities do have licensing and stuff for those people involved in that, right?
Okay,
if you're
right.
going in for whatever. But yeah, FDA, does not directly regulate them. Now, they do have to be labeled if you're selling them, like put them on the market to sell them. They have to be labeled properly. That's and California has volatile organic carbon limits
Okay.
that have to be adhered to. If anybody has a question, they can get a hold of me. I can work with them.
Okay, perfect.
I can send them direct links. But yeah, basically FDA, it's not something that they're too much concerned with.
Okay, so for just to explain in Portuguese for who is watching us here, so o que o John falou é que não tem necessidade para velas aromáticas a questão de registro. Tem alguns requisitos para alguns estados, como a Califórnia, a questão dos ingredientes que compõem, tá? A vela aromática, mas não tem uma obrigação de nenhum registro no FDA. E estudos de eficácia também não tem essa obrigação, né? Só se você for fazer uma questão de uma outra empresa, uma comercialização para um outro país, enfim, isso é necessário, mas para o FDA não tem necessidade para os cosméticos. Another point, John, that you'd like to know is about the sunscreens. So we know that, for example, in Brazil, sunscreen is necessary registration, and in Brazil we need to send a lot of documents to prove the efficacy of this product and how it works in United States.
Okay, in the United States, sunscreens are regulated as drugs, not cosmetics.
Okay.
So, and that's true even if you, in a cosmetic product with a sunscreen in it, like a foundation or whatever, it's still a drug. So that process, you have to go through the FDA Center for Drug Evaluation and Research, CDER, right?
Okay.
If you go online and you go in the FDA and just put in sunscreens, you'll get all the information you need. But yeah, they're not cosmetics in the U.S.
Okay. And when you talk about drugs, because when you talk in Brazil, when you say drugs, drogas, medicamento, in Brazil, we have more documents, more restrictions. So how it's working in United States when we talk about drugs, that is classified some sunscreen, which is necessary, which is the process?
Well, okay, there's drugs and there's cosmetics.
Yeah.
Okay. And if you just have a product that's just for sunscreen only,
okay,
you don't have to file that under cosmetics. But if you have one that's a moisturizer with a sunscreen,
okay,
then you got to do both. Right?
Okay.
Right? Yeah. So and it can get kind of complex. So I would say get a hold of you, right? And we can work it out if somebody's has questions. But basically, if it's a sunscreen, you start with the drug part.
Okay.
Right?
All right.
Right.
Yeah. Perfect. And the last one that I have here is about the license. Which license the company that you'll be represented at FDA needs for registration for cosmetic products at United States?
Well, yeah, the registration is pretty simple. You have to, there's FDA has a website. It's kind of called FDA Direct.
Okay.
And it gets a little bit, if you don't use it gets kind of crazy. But yeah, there's no barrier. You just have to go in there. You got to have all the basic information. You have to have a DUNS number.
Okay.
You have to have DUNS number. You have to have no, you don't. I'm sorry. I take that back. For drugs, you need a DUNS number. For cosmetics, you only need an FEI. All right. FEI is the establishment, FDA establishment identifier.
Okay.
Right? Now, if you've been in business for a few years, you probably have one and don't know it.
Okay.
Right? But you have to go on the website, FDA, look FEI number, and it'll tell you how to find out and all that.
It's not necessary more things, right? It's just it's just the number of the company that must be registered there.
Well, FDA has this big website. It's called Oasis.
Yeah.
And it has every company in the world is on it that ever sent anything to the United States or bought anything from the United States. It's all there. So, it's physical facility.
Okay.
The physical facility has a number, and that has to go on the registration, right?
Okay.
And then the registration, you also have to list the brands that you manufacture for and the type of products. There are 17 classifications of product under FDA. And so you got to say, okay, brand number XYZ, and these products like 14, 7, 5, whatever, right?
Right.
So that's all you got to do. It's not that hard. Like I said, no money involved. You don't have, as long as you can get through the process and, yes, yeah, you're approved, or it's not an approval. That's a good, important point. A lot of people say we're FDA approved just because they registered. It does not mean you're approved.
Okay, because it don't have any analysis, right?
Right. So if you put FDA approved on any FDA product, you're going to get, you're in their headlights, so to speak, in English.
Yes, right? I got it. Perfect. So for the moment, we don't have any more. We have already concluded our webinar right in the time that we proposed it. So John, thank you very much for this opportunity. If you receive more questions, of course, I will send it to you for your, can give us the answers to send to the people that would like to understand more. But it is great to have you as a partner to expand the business for the companies that establish in Brazil and that they are interested to commercialize cosmetics in United States. Thank you very much for this opportunity, for sharing knowledge about cosmetic at FDA, and I hope that we can expand our partnership with other topics that is so important for the Brazilian companies. Thank you very much.
Definitely. Thank you. You're welcome.
Muito obrigada. Muito obrigada a todos pela participação.
Igualmente.
E nos vemos na próximo webinar da Legis Consultoria.